Once your baby no longer requires the pressure support of the nasal INV or the ventilator, you may see the baby's next step be to a cannula, something we call a nasal cannula. This will deliver just a little pressure if needed and will give the baby oxygen if he's still requiring oxygen. So let me show you what that looks like. This is this young lady's nasal cannula. So you can see it's still in the nose, but the prongs are smaller now than they were with the nasal INV. That's because we're not delivering any pressure to this baby, just a little bit of air or a little bit of oxygen, depending on what the baby requires. All of our babies in the neonatal intensive care on heart rate monitors. The heart rate monitor is going to look like this machine right here. And what you're seeing, this top line is giving you the baby's heart rate, and the second line is giving you the respirations. That way we can monitor the baby's heart rate and respirations constantly and never have to worry about whether the baby stopped breathing, whether the baby's heart rate slowed down. Of course, don't be afraid of the numbers and don't focus too much on the numbers, because when the babies move around, like our babies do right now, you may get some false alarms, you may get a lot of interference in the numbers. What we tell our parents usually is if the nurses are looking at the monitor and just silencing it and not doing anything with your baby, then it's probably just a motion detector going off. If the nurse is actually moving and intervening with your baby, then maybe something's going on. The other monitor that's actually hooked to your baby is going to be an oxygen saturation monitor. What that number tells us is how much oxygen is actually traveling on your baby's red blood cells at any given time. We like for that number to be greater than 90. Now this baby's number right now is reading 80 and it's flashing, but I know that it's not a true number because this bottom line is so erratic. It's telling me that the baby's doing a lot of moving. So all I have to do is look at the baby. She's nice and pink, so I know that that's a false alarm. We know that having a baby in the intensive care nursery can be very stressful, very scary place for you to be. We do want you and encourage you to participate in your baby's care at all stages of their hospital stay. It promotes bonding. It allows the families to become familiar with their baby and prepares you for discharge. So when your baby is very sick, you may be allowed to give a pacifier to your baby. You may be allowed to change a diaper. When your baby gets better, we encourage you to do as much of the care as you'd like to. We'll certainly let you feed, rock. In the evenings, we encourage parents to come in and do the baths. This will get you familiar with your baby and ready to go home. We welcome all questions that you have. We know that you're under a lot of stress when your baby's in the intensive care nursery. Don't be afraid to ask us anything. There are no dumb questions, and it's not possible for you to remember everything that we're trying to tell you about what's going on with your baby's care, especially when you're very frightened about what's going on with your baby to begin with. Now, one other thing that may be on your baby at one point or another are these blue lights, and what these blue lights are phototherapy lights. Your doctor or your nurse may tell you your baby's bilirubin is too high. They may call it yellow jaundice. Anyway, what's going on is babies have lots of red blood cells and their liver doesn't function as quickly as ours does, so they have a lot of trouble getting rid of those red blood cells. This light on the baby actually stimulates the baby's metabolic processes in order for them to get rid of the old red blood cells that cause the yellow tinge to their skin. So this is a very common thing that you may see on your baby. Once your baby is in an open crib, we welcome you to bring clothes from home in order for your baby to have something besides hospital attire. Although we do have a lot of donations given to the NICU with baby clothes. If you'd like for them to wear their own clothes, then you may certainly bring these in. I would encourage you not to bring anything that's an heirloom or anything that you want to save. Although we do our own washing up here of the infant's clothes, sometimes a piece of clothing may actually go missing, and we hate for that to be something that you can't replace. We know this time in your life is very stressful, very anxious. We want you to feel as comfortable about having your baby in the NICU as possible. We want it to be as positive an experience as we can. So the nurses and doctors here in the NICU, our first and foremost goal is to make you comfortable, make your baby comfortable, and get you ready to go home. This is the entrance to the neonatal intensive care. It is a controlled access, which means the doors are locked and you can't get in without us knowing about it. To access the phone of the secretary, all you have to do is pick up this phone that's on the wall and it'll ring. The secretary will answer the phone. You tell them who you are and what baby you want to see, and they'll open the door for you. Everyone that comes into the neonatal intensive care is required to wear a cover gown that you'll find here in the closet. You'll put one on and it'll tie in the back. We're very conscious of infection control here in the nursery because all of our babies are a little bit immunosuppressed, which means that they haven't developed their system so that they can fight off infection very well. So that's the reason that we ask you or anybody else that comes with you to wear a gown over their street clothes. Once you enter the nursery with your cover gown on, we ask you to wash your hands. We ask you to wash your hands initially for 3 minutes. This is a sink that you'll be using. There's several sinks all around the unit. The water comes on by waving your hand in front of the little electric eye, and you can choose any soap that you want. We ask you to scrub up really good for 3 minutes up to your elbow, taking off all of your jewelry. That includes your rings and your watches up to your elbows. And then of course there's your paper towels to dry your hands. And once all this is done, then you're able to come to the baby's bedside and the nurse will greet you there.